Hi, I'm Joe DiMatteo of the Len and Joe Ask the Pharmacist broadcast, pharmacist, clinical nutritionist, Doctor of Naturopathy. Checked our website at lenandjoe.com or mscompounding.com for times, stations, XM, satellite, local stations around the country where you can listen to the radio broadcast. We talk about health-related topics on an ongoing basis every day, 6 days a week. Today we're taking just a snippet as to a follow-up to our first discussion about migraines and migraine triggers. Migraine triggers, we covered everything from, God forbid, an organic disorder, a tumor, to TMJ, to stress, to spinal misalignment, to a lot of tension and distress, pulling and tugging on the atlas and on the cervical area, on the base of the skull, initiating. Headaches or being a trigger for headaches. Headaches certainly are a very complex, migraines as well, are a very complex situation to attempt to define for folks. But I think that what we want to try to do here today is to make sure, as we've covered some of the, generically and quickly, some of the triggers, food allergies play a huge role. And I don't even know that I stressed and emphasized that enough in the first teaching. Food allergies are a huge problem today. They're triggers because you can have a true food allergy. You can have a leaky gut syndrome that allows foodstuffs or chemicals, colors, and dyes to actually make its way into your circulatory system, creating an aggravated immune response, certainly being a trigger. Food allergies, I did not stress in the first teaching, is a huge trigger. So how would Len and I approach this? What would we look at? Number one, we'd probably look at some type of food elimination. Many of you know, if you're a migraine or headache sufferer, you know, and if you've been to a neurologist, they'll even talk to you about some of the basics. Aged foods, tyramine-containing foods that are maybe pickled or processed, aged cheeses, wine, beer, foods that have a high yeast content, have a high tyramine content, have a high sulfite content. Now those are triggers that are not necessarily allergies. But certainly we can have certain foods that we are allergic to that we don't manifest with a skin reaction, hives, blotching, itching, or dermatitis, but it can be a trigger for a headache. For others it can be an intestinal, a digestive problem. So let's focus for the next few minutes, once we move beyond or past the food side of this and dealing with allergies or sensitivities to foods, how do we then take you to the next level? Part one would be we would do some type of food elimination. Or we might do a modified elimination or an aggressive elimination, maybe a food sensitivity testing panel to see specifically what those foods may be. Starting point, that's what we're going to start with. Number two, we're probably going to make sure you do something very basic, and that's hydrate. Dehydration is a huge component. Your body is highly dependent upon adequate hydration on a daily basis. You would be amazed at just having individuals increase their fluid intake, not necessarily caffeinated or carbonated, sodas, whatever. I'm talking about water, consistently, not all at one time, but consistently pulsed throughout the course of the day. So hydration becomes part two behind food elimination. Number three, let's talk about some critical nutrients. And I'm going to come back to a few other things that the toxic bowel syndrome. Let me just deal with that right now. Toxic bowel, because that's more in the food, the gastrointestinal, food allergy side. Toxic bowel syndrome, if someone has a lot of bad bacteria growing in their intestinal tract because of massive exposures to antibiotics or a lot of stress, low fiber, high sugar intake, they have a lot of bad things growing in the gut, or a very dismembered or disordered balance of good and bad. What can happen is the process where gut bacteria can act on an amino acid, tyrosine, and convert it to tyramine, which is what you're trying to stay away from in certain foods to be a trigger, can affect you. So good, viable, active cultures, live cells, quality forms of probiotics can be very helpful. So gastrointestinal issues can play a role. Dehydration can play a role. We know that a food trigger can play a role. So those are some of the ABCs. Permeability, gastrointestinal permeability would tie into this, and that's an area of another discussion, but let's suffice it to say that even just some good bacteria could be helpful in that area alone. Let's move on to a couple nutrients and a couple preps that I think that are very, very helpful. Number one, it doesn't receive much attention, it doesn't receive much study, essential fatty acids. Omega-3s specifically are very, very helpful, and there's a simple reason. It can reduce platelet aggregation or platelet stickiness, number one, and it reduces pro-inflammatory, what are termed cytokines, or inflammatory proteins that are a huge trigger for headaches and migraines in this inflammatory response. Two things quality forms of omega-3s do: reduce the stickiness and reduce the inflammatory proteins that are circulating throughout our systems. Number two, whatever the number is, riboflavin. Energy production potentially can be a problem and a trigger for migraines that are chronic and headaches. Riboflavin is involved in NADH production. It's a flavin-type compound that is involved in energy production within the cell. Cellular mitochondrial energy, weakness, deficits, whatever you want to term it, are associated with chronic headaches, chronic migraines. Riboflavin, titrated dose. We dose specifically and independently depending upon the individual. The other area from a nutrient standpoint, magnesium can play a key role. Most Americans, the bulk of Americans, are magnesium deficient. Poor soil, poor diets, refined products, not enough vegetables and fruits. Magnesium deficits are huge, and they play a couple areas from a vascular standpoint, from a spasm or a contraction of the vascular wall, and also what we would term from a neurogenic standpoint. It also is involved, magnesium is critical in a lot of brain neurotransmitter production and conversion. Magnesium titrated, the type and the form of magnesium, we have one listed here, Mag Essentials, very bioavailable and absorbable. B6 can play a key role here as well from a conversion standpoint, brain neurotransmitter conversion, and as well as a cellular energy. You might be thinking at this moment in time, well, that's a lot. I can't remember all of that. That's where you set up an individual time, and we can go over these specifically with you. But these are nutrients that are proven, that have scientific evidence to support their benefits. Let's talk quickly about 5-hydroxytryptophan. I mentioned in the previous teaching that serotonin deficiencies. Well, pharmaceuticals many times are used, but pharmaceuticals don't help you make more. They just keep more available within your body. 5-hydroxytryptophan, an amino acid, is a precursor to serotonin. In some folks, raising 5-HTP levels, encouraging serotonin production, can diminish their headache and migraine tendencies. Another option. Coenzyme Q10 falls back to the riboflavin B6 cellular energetic issue. Coenzyme Q10 helps to donate electrons, helps to encourage mitochondrial transport, what we call electron transport. Simple terms, cellular energy. Without this cellular energy, you are more prone, unfortunately, to headaches and migraines. Coenzyme Q10 can be good forms, Japanese source, solubilized in oils, and even some of the newer concepts looking at ubiquinol. We still are sticking with good CoQ that is manufactured well, that is solubilized in an oil-based substance. That's where you need to be. 5-hydroxytryptophan, a precursor to serotonin. Coenzyme Q10, a cellular energizer, written up in some of the journals and archives of neurology back, I believe, about 5 years ago, showing that coenzyme Q10 in children, in youngsters, and adolescents can reduce migraines by up to 50%. Riboflavin, dosed correctly, can reduce the triggers for headaches and migraines by 50%. Magnesium shown in numerous studies to average about a 41% reduction in migraine and headache triggers. We've covered a lot of areas, everything from hydration. I didn't even talk about tenacitum and Petacites hybridis. Those are some compounds that are helpful too. I stuck pretty much to a nutrient side. I hope maybe you've learned something from these last two teachings on headache, on migraines. Hopefully you will pursue, if you're battling this scenario, we have other very, very specific and detailed issues that we'd like to go over with you as well. LenandJoe.com is where you can reach us. Thanks for listening in.